by Alexis, Alicia, and Caitlin. Paul is a 40-year-old male who is going to the doctor's office for his yearly checkup. Prior to this, Paul has noticed that he has been sweating more than normal, tasks like walking up the stairs have been leaving him breathless, and he has noticed that his weight has been steadily increasing. Upon finishing his assessments, the doctor tells Paul that because of his height of 6 feet and weight of 300 pounds, his BMI is 40.7, which puts him in the obese category.
Obesity is the result of energy input exceeding energy output. Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Body mass index, or BMI, is a simple index of weight to height that is commonly used to classify overweight and obesity in adults. A BMI equal to or greater than 25 is considered overweight, and a BMI of over 30 is considered obese. Healthy BMI is within the range of 18.5 to 24.9.
Risk factors of obesity include genetics, diet and lifestyle, socioeconomic status, culture, and metabolism. There are over 200 genes that play a role in regulation of energy input and output. Portion sizes within our Western society have increased over the years, making it easier for people to increase energy input. Our society has also become more sedentary, which leads to less energy output. Remember, obesity is caused by energy input constantly exceeding energy output.
Some signs and symptoms of obesity are breathlessness, increased sweating, snoring, difficulty sleeping, inability to cope with sudden physical activity, fatigue, and back or joint pain. Along with these signs and symptoms, obesity can lead to serious health problems such as hypertension, high levels of cholesterol, type 2 diabetes, and it can also increase your risk of heart disease and stroke.
Physiology can be explained as maintaining homeostasis by keeping energy input and energy output equal. Adipocytes produce various hormones, one of them being leptin, which plays a key role in maintaining homeostasis with energy input and output. Leptin is a protein hormone that goes to the arcuate nucleus, which is in the hypothalamus of the brain. It eventually causes corticotropin to be secreted from the VMN of the hypothalamus, which suppresses the appetite and inhibits eating. Leptin is secreted when there is an increase in body fat mass, and it is an indicator of the body's total energy that is stored in fat tissue. Insulin has the same effect as leptin when it comes to suppressing the appetite, but is less potent. Insulin is secreted by the pancreas and attaches to protein receptors that activate the protein channels that allow glucose into the cell so the cell is able to use the glucose for energy. Ghrelin is the opposing hormone to leptin. Ghrelin's function is to increase appetite and stimulate eating. Ghrelin is secreted mainly in the stomach, and it signals the arcuate nucleus of the hypothalamus that your stomach is empty.
For the pathophysiology of obesity, it starts with the disruption of homeostasis, when an individual is always consuming more kilocalories than they are burning. This causes an increase in the size of the adipocytes, which causes more leptin to be produced. The increase of leptin actually causes the body to be less receptive to it, and therefore it no longer works to suppress the appetite, which leads to overeating. The adipocytes also produce fatty acids, which the muscles start to use for energy rather than glucose. Because of this, there is excess glucose in the bloodstream, causing more insulin to be secreted. This oversecretion of insulin causes the cells to become resistant to it. This means that cells stop recognizing the presence of insulin in the bloodstream because it is always present. Because of this resistance, insulin does not bind onto the receptors that are on the cell membrane that would normally allow the glucose channels to open and let glucose into the cell. The excess glucose in the bloodstream is then converted into fat rather than used by the cells for energy. Fat cells also start to produce a variety of other things, such as cytokines and interleukins, which are pro-inflammatory, and that can cause issues with many different diseases, such as cancer and cardiovascular diseases.
Brief summary of obesity. It is defined as having a BMI of greater than 30. It is caused by energy intake exceeding energy output. The adipocytes grow in size, which causes them to release an increased amount of hormones. These hormones lead to your body's inability to suppress your appetite and properly use glucose, which leads to the overeating and causes excessive weight gain.
The phospholipid bilayer of the cell membrane has both protein receptors for insulin and protein channels for glucose to enter the cell. Leptin is a protein hormone that binds onto cell membranes in the hypothalamus, which signals to the body that you are full. Insulin is a protein hormone that is key to the regulation of glucose relating to obesity. Insulin attaches to protein receptors on the cell membrane, and glucose enters the cell through protein channels. Homeostasis is disrupted when energy input is greater than energy output, rather than them being equal.
Paul's doctor gave him recommendations for how he could effectively lose weight. These recommendations included monitoring his diet, watching his portion sizes, and trying to do some form of physical activity for 1 hour 5 times a week. It has been 4 since Paul saw the doctor and adjusted his lifestyle, and he has already lost 15 pounds.